Hello everyone, my name is Dr. Yuvraj Sawant. I'm a practicing nephrologist in Kolhapur. Today we are discussing one of the important symptoms of kidney disease or in cardiac or renal problem like pedal edema. We'll discuss what are causes, what are symptoms, and what are the treatment for the edema and chronic kidney disease. So first, I will just discuss what is pedal edema. So pedal edema is a condition where extra fluid accumulates in the lower legs and feet, causing them to swell. This swelling can happen for several reasons, such as heart problem, liver issues, thyroid issues, kidney problem, and blood clots. So our body fluids are divided into two main areas, inside our cells and outside them. The outside area includes space around our cells and inside our blood vessel. Edema or swelling occurs when there is a problem with how fluids are distributed between this area. Like what I discussed, like for edema to occur in a body, there should be at least 5 liters of water excess to develop edema in the body. That is a minimum fluid required. And this problem can also happen if too much of pressure built up in the blood vessel, often due to the heart issues or excess fluid. It can also occur if there aren't enough proteins in the blood, like albumin, which helps to keep the fluid in the vessel. Additionally, the lymphatic system normally helps to move extra fluid and protein back into the blood. So when there is a problem with the lymphatic system is not working properly, the patient can develop edema, that fluid built up and causes swelling. And lastly, in kidney disease, edema is one of the important cause. The kidney plays a crucial role in regulating our body fluid balance. As we know, there is a kidney filter around 180 liters of the blood per day. The kidney helps to remove waste and regulate the fluid. So when they are not functioning properly, the fluid accumulates in the body, leading to edema. Where we can see the edema in kidney disease like acute kidney injury, where there is sudden decrease in kidney function. We can see the chronic kidney disease, what we call as CKD, and another condition when there is a protein leak in the urine, the condition we call as a nephrotic syndrome. And edema is one of the important and major symptoms of chronic kidney disease. Let's explore how we have to approach edema. So like when any patient presented with the edema, what things we should do and what next we can do. So first, as any patient, we have to take the detailed history. Okay. So like whether the patient has heart problem, kidney problem, thyroid disorder or liver disorder or any low albumin causes. Okay. So the according to history, we have to diagnose the what is the cause of the edema. Then we have to categorize whether it is a generalized edema or it is a localized edema. What is generalized edema? This type affects the entire body and large area is often linked to a condition such as heart failure or kidney failure. Like when you will have edema all over the body, like you will notice in the eyes, you notice in the legs, okay, you notice in the abdomen, okay, everywhere there is a edema. What is localized edema? They will only you will get in the one part of the body, like you will get only legs, hand, okay. Like in will what you call as a localized edema, where you will get especially infection. If you have leg infection on right leg, you will get edema on the right leg. Infection of the hand, you will get swelling on that hand. So that we call as a localized and edema. There are two types, generalized and localized. So next, what physical examination you have to do? We have to do whether it is a pitting or non-pitting. Though diagnostically there is not much of importance, but we have to see pitting. What is pitting? You have to put a pressure on the legs or that edema part. You will there is an indentation, okay, where you will get in heart failure and nephrotic syndrome. What is non-pitting? There is no indentation after the pressure, where you will get in lymphatic obstruction or hypothyroidism, what we call as a non-pitting edema. So now what we have seen, what are the causes, what are the types, this is generalized or localized, whether it is a pitting and non-pitting. Okay, so accordingly you have a clinical diagnosis that this edema is because of cardiac problem, heart problem or kidney problem. Next, we have to go for the investigation. We have to prove that this problem is because of the kidney or heart or other problems. So what, suppose if you are suspecting kidney diseases, like if patient has long-standing diabetes, hypertension, so next you have to do the some lab test and some imaging that will tell you that patient will have kidney problem. What are that blood tests? They are very simple. What you have to do for the kidney problem diagnosis, you have to do CBC, you have to do the renal function test. CBC means complete blood count. You will get low hemoglobin. Renal function test, you have to do serum creatinine. Then you have to do urine analysis. You have to look for the whether albumin is passing from the urine or not. Okay, urine albumin creatinine ratio and the ultrasound of the abdomen and pelvis to know what is the kidney size and what are any what is the kidney size, any kidney infection or anything is there. So these are the basic blood tests you have to do after your examination is over. So based on your history and your physical examination, that will give you the what is the exact cause of the edema, and that specific things will guide you for your further management plan. So now you have diagnosed the that there is edema and you have diagnosed what is the cause of edema. Next come what is the treatment we can give. Okay. So yes, for local edema, the non-pharmacological measures include like limb elevation. You have to elevate the limb that help in reducing the swelling. Then the compression therapy, you have to wearing the compression stocking that can assist improving the blood flow and reducing the edema. Then physiotherapy, you have to give massage or physical therapies to be performed by the trained professional. And ice application, like you have to give use several or congested edema for the ice application. Okay, that will also help in reducing the edema. In cases where systemic causes are at play, okay, such as in CKD, so your edema causes because of the chronic kidney disease. So treatment focuses on reducing your fluid retention and addressing the underlying condition. So what things you have to do? First, you have to do what you have to do the salt restriction, okay, salt and fluid restriction. So limiting salt intake helps to prevent fluid buildup and manage your volume overload. That is the most important thing. Next comes whatever the extra fluid that is accumulated in your body, we have to remove it with the specific medication. What is this called as a diuretics? Okay, so what diuretics do? Basically, they act at the kidney level. Okay, they went in the kidney and they remove the extracellular fluid, means they help in removing the water. What are different types of diuretics? There are three types of diuretics. One is a loop diuretics, what we call as a furosemide, torsemide. Okay, they are often preferred and they are longer duration of action. Then other thing is a thiazide diuretics. They use adjunctively for enhance the diuretic effects along with the loop diuretics and potassium sparing diuretics. So they also use along with the loop diuretics. There are some specific indication and you have to use cautiously due to the potential risk of hyperkalemia. So the choice and the dose of diuretics depends on the factor like severity of the edema, patient hemodynamic status, kidney function. And it is important to use diuretic cautiously to avoid complication like hypokalemia, hypotension, electrolyte imbalance. So when the patient is on diuretics, the regular monitoring of the fluid volume, urine output, and blood pressure, weight, periodic test is essential. So definitely you have to start your diuretics under physician guidance and you have to monitor it. Another things required for the managing your chronic kidney disease, as we have discussed, you have to do the salt and fluid restriction, essential for the control fluid retention. High dose diuretics, loop diuretics like furosemide or torsemide, they are usually effective in controlling the edema. So managing edema involves a tailored approach. Okay, for local causes and non-pharmacological method are key, and systemic causes require dietary adjustment, diuretics, and close monitoring. So patient education is crucial. Many times we have seen this edema is considered as a insignificant problem as many patients say this is just simple thing that we can neglect. No, edema is a very important condition. You may have underlying significant critical cardiac, kidney problem or liver problem. So it is very important to tackle the edema very meticulously, and you have to investigate thoroughly. So what I say that patient education is important. Understanding the condition, following the treatment plan, and making the lifestyle changes can improve the outcome. As any other disease or any other symptom, early recognition and effective symptoms management can help to prevent the complication. Thank you.